Hello and welcome to Connect and Collaborate. I'm Alex Hopkins, your on-air producer, and today we are having our monthly check-in with DORA, Colorado. That is the Department of Regulatory Agencies of Colorado, and I have in studio with me Rebecca Laurie, who's the Director of Communications. How are you doing, Rebecca?
Good, Alex. Thank you so much.
Yes.
I can't believe it's December.
Already.
How did we get here?
Oh gosh, well, it's been a long year, but also a short year.
Right.
It's one of those, I felt
just whizzed by.
Yeah, January lasted forever, and then all of a sudden, October, November, December just kind of fell all in 1 month.
Yes, it just smushed together, didn't it?
Yes.
Well, thanks for having us here, as always. We like to come onto the program each month to talk about different topics related to regulation, related to the Department of Regulatory Agencies, and try and demystify the government processes that are happening on a daily basis that affect so many people, our businesses, our consumers, and this time around, we have an extra special guest with us.
Yes, one that we've had on before.
Yes.
Yeah, go ahead, please.
Oh, okay. All right. We have Marguerite Salazar. She is our Executive Director for the Colorado Department of Regulatory Agencies. She's also the former Colorado Insurance Commissioner. She was appointed by Governor Hickenlooper last year, and she had served as insurance commissioner since 2013. But prior to joining the state, she served as the Region 8 regional director for the Department of Health and Human Services. And she was appointed by President Barack Obama to oversee the implementation of the Affordable Care Act at that time, not only in Colorado, but in Wyoming, Montana, Utah, North Dakota, and South Dakota. And she also led one of the largest community health centers in the country for over 25 years. So as executive director, she has brought a wealth of leadership and experience. She oversees 9 divisions as well as functions of the executive director's office, which includes administrative oversight, but as well as the Colorado Office of Policy Research and Regulatory Reform, COPR, who we had on last month, and the Broadband Fund. So welcome, Marguerite. We're so glad to have you here.
Thank you, Rebecca. It's great to be here.
Let's jump right into it.
Sure, yeah.
One of the things that I have really enjoyed about working with Marguerite is her philosophy regarding the role of regulation. Can you highlight what your philosophy is, Marguerite?
Sure, I'd be happy to. One of the things that Rebecca talked about is how do you demystify what regulation is? And so that is something that so many people think is such a burden to take on and to, who wants regulation? Regulation is often seen as something really bad. So when you start tearing it apart maybe, or unpacking it, maybe is a better term. I have often used the 4 freedoms. And the 4 freedoms were those ideals that President Franklin D. Roosevelt set up way back when he was president, and he was trying to inspire the country. So he had Norman Rockwell paint these 4 pictures that were depicting, for example, the freedom of speech, which is my favorite, freedom of religion, or freedom to worship, freedom from want, and freedom from fear. And those were 4 Norman Rockwell pictures that really helped pull the country together and help them understand, just what a great country we live in. So, but from that, the whole idea of how do you preserve those freedoms came about. And it wasn't until 1960, 61 when the whole concept of consumer protection started being talked about. And it was actually President Kennedy then who did the first Bill of Rights for Consumers. And then we started seeing things like the Consumer Reports magazine and on, until, then consumer rights and protections really became an honest, important issue. But the idea around how do you protect those freedoms? Well, it comes from having, freedoms equal certain rights that you have. So, okay, but with rights, how do you keep those rights? Well, you have to have protections. And in order to preserve those protections, you have to have regulation so that people can follow rules and that we always play with an even and a level playing field. So to me, that's how, you go from the 4 freedoms to regulation. And it really does help. When so many every year we do the sunset process, which you've heard about, but we also do a sunrise process. And different groups come to us and talk about how they want us to regulate them. And it's all, I was really surprised to hear that, but what they're really asking for is a set of rules that everybody will play by. And we know that all of that then equals protecting consumers, because we know what's out there. And if you're told that your barber or cosmetologist or plumber or electrician they're all going to play by the same rules, then you don't have to worry about who comes into your home to do that work.
So that certainly comes with its own set of challenges, I would imagine. Marguerite, what are some of the biggest issues or challenges that you have tackled as executive director so far?
Well, the first one that comes to mind has to be working with the Office of Civil Rights, the Division of Civil Rights. And, while it seems like it's such one of those divisions that would be really, just the fun one in a sense. Of course, who wouldn't want protections for civil rights? We've had really interesting cases, such as the Masterpiece Bake Shop case. And that one has really challenged the whole difference between freedom of religion, freedom to worship, and public accommodation. And so that one has really taken its toll. It even ended up at the Supreme Court. And so that was tough. And it's not over yet. We still have what we're calling Masterpiece 2 that will continue way after I'm gone. So that has been a big one. Another one has been some work that we've done with the PUC, the Public Utilities Commission. And, I know that people here in Denver have often questioned, how do we regulate Uber and Lyft? How do we deal with towing companies? All the different things that are happening there. And then RTD and the railroad system. Because for so long, we had the issue around the horns that were blasting on the tracks. And that was one of the first things that came to me when I became the executive director, were complaints from all over the hotels saying we're losing customers because the trains are blasting their horns in the middle of the night. What can you do to stop that? And the truth was that it really wasn't something under our control, but because we do monitor and we're the ones who take care of railroad safety and the crossings. We did have to take that on. And so that was a real tough one. Not luckily, they did a lot of hard work to get it fixed, but it's taken care of now. That was a really big deal. And you can imagine, here I'm coming from healthcare background, insurance, and now I'm dealing with issues of railroad crossings. And I guess the other one would have to be all the issues around cryptocurrency and blockchain and those kind of things, because it's such new technology, and it's, but yet it's spreading across the country. And we don't want to be looked at as an entity that's holding back innovation or creativity, and that's not at all what we're trying to do. But again, we have to protect consumers, and there's a lot of fraud that is taking place, a lot of companies that are setting up ways to pull in money, and we've had to shut those down. Mm-hmm. So in fact, I think in the last 2 or 3 months, we have issued probably close to 18 cease and desist orders of companies that we're finding on the website who are actively soliciting money and investors, and that's against the law with cryptocurrency.
It is. I don't think I realized that. I know we had a whole episode on cryptocurrency earlier this year, and it's fascinating, but I didn't realize it was against the law to solicit money.
Right. Anytime, because it becomes a securities issue at that point when you're taking money from somebody and trying to, telling them that they're going to earn money or if they invest it, they're going to get something for it. That's a securities issue. And there are no laws or regulations around how to do that with cryptocurrency. Now they're working on it, mm-hmm. and this next year there's a lot of discussion about how to regulate cryptocurrency. So we will soon see some regulations, but again, it's about protecting people from losing their life savings.
Exactly. It is a bit of the Wild West right now.
Right.
And what we've seen with those cease and desist orders coming from the Division of Securities is that often the websites or the portals to send your money are not real.
Oh, wow.
And so there's that is where fraud is taking place.
And it's just so sad because it's one of those, entities, it's really new, and so people get excited about it, and they want to invest on the ground floor for this type of new wave items like that, right? And so you want
Right.
to be excited to get into it. At the same time, you want to be protected. So
Right, and
yeah.
as Marguerite had mentioned, there's no intent to stifle innovation, but you don't want people to be fleeced.
Exactly.
Yeah.
Exactly, and especially older people. And, luckily we do have laws that require banks to report if someone is coming in, regular customer comes in, but suddenly shows up with a nephew and niece or a younger person that's a friend, and they're doing all the talking and asking all the questions. The banks are now required to let us know that that's going on because, again, elderly people are so much at risk and to have their life savings taken away. So I'm always really proud of the staff when they are able to prevent that from happening. And that's one of those things that does prevent, because it's hard to always be enforcing. Again, we look like police when we do that, and we're not that. But we're trying to always prevent things from happening, doing a lot of outreach and education to let people know to be very, very careful.
Which is a great segue into the next question, which is, what would you consider some of their largest successes?
Well, I think one of the biggest would be, again, over the past year, we developed a very strong relationship with the Denver Police Department. And what we saw there was that oftentimes we were issuing, again, cease and desist orders against maybe somebody who was practicing plastic surgery and they really weren't a plastic surgeon. So we would say, okay, you have to stop doing that, and we'd shut them down. But then they would show up 4 blocks later, open up again, and start doing, a practice. And it's really unfortunate and really sad that people will actually pay money to people to do plastic surgery or different liposuction, stuff like that, who aren't qualified to do that. So again, like I said earlier, we're not police, but we talked with the police department to say, how can you help us follow up with catching these people? And once we issue the cease and desist, how can you then help us to make sure that they don't go back into practice? And it was hard for them to truly understand what we were doing. So we actually went into the police department, took several of our division directors and did videos, training videos for the different policemen around the city. So we talked about what civil rights does, what securities does, what banking is, and the biggest one though had to be the Division of Professions and Occupations, so that they could understand, some of the issues around massage parlors, which are huge, and the police know about that because often, not all of them, but there can be drug dealings, human trafficking, things like that, that the police then knew that if we're finding and shutting these companies down, what can they do to help us and partner? And once we did the videos, and they're using them now for training, that the partnership and the number of handoffs has just been a whole lot better. So it's a lot around transparency, trying to really pull the curtain back on what we do as regulators, but that we can't do it alone. One of the things, just pushing on that, is that we this last week, or actually it was 2 weeks ago, did some they were Get Wise Awards with our community partners. And what happened was that we were talking one day about some of the issues with taxi cabs, and there is a flat rate that taxis are supposed to charge from DIA to downtown Denver. And a concierge at the Sheraton Hotel, in talking with customers who were coming to the hotel, found out that people were being charged all kinds of money, and it wasn't the $56 or $58 flat rate. It was often $90 or $100. And so he took it upon himself to start keeping records, and then let us know, informed us about this practice. We were then able to go in and do an investigation. And then the Concierge Association got together, and they all helped us stop the taxis from doing that. Isn't that great?
That's a great story. I
Isn't
love
it?
that. Yeah. But
Yeah.
a way to crack down. I would be very angry if that happened to me. And I am assuming they are saying it's one rate plus whatever I drove.
There were
Yeah,
all kinds
right.
of stories is what we found out. All kinds of reasons of why the flat rate was more than the flat rate.
Yeah,
Right,
that's
right.
insane.
But yeah, and we wouldn't have known because a
Right.
lot of these are out of town folks. They don't know to call us, but the concierge, they were, alerted. They knew that was wrong, and they're protecting their customers. So we gave them an award. We gave AARP an award, who works again real closely with the insurance division, so that they can make sure that elderly folks understand what their rights are, and know how to access Medicare. If they lose, coverage, they can help get people back on, and so they're really good partners in that regard. The Jeffco Sheriff's Department was also honored because they help our real estate division in training real estate agents how to be careful and how to be safe when they go out to show homes. And so again, partnered with us to make sure that real estate agents are going to be okay. And so, we found there were several others that we gave awards to, and the idea was these are not people that we regulate, but they're truly our community partners. Another one I have to mention is the Better Business Bureau, because again, to me, I grew up watching them, and they were sort of the Good Housekeeping seal of approval. Well, Better Business Bureau has been reporting to us when one of their members loses his or her license, or the business shuts down because of unscrupulous practices and things like that. They've now been letting us know this is going on, so we can monitor and check on their practice, and again, follow up with the cease and desist order. So here, it's a great partner. They're sort of like the private version of the Department of Regulatory Agencies. So that's really fun, because then we know we're not by ourselves, that we've got community partners out there. It's our Get Wise campaign, which again, I've got to mention that because it's our little owl that we use to tell people to take 5 minutes to get wise, with the idea that we need our consumers to also do their part, to get out there to check and see if someone truly is who they say they are. And we've spent a lot of time and resources putting the information on the website so that people can check a professional license, or make sure that the doctor they're going to go see is who she says she is, those kind of things. So so these are Get Wise awards because again, here's the community helping us take care of our consumers and make sure that our regulations are followed.
One other thing that we should definitely bring up is actual recoveries that take place. Do you want to talk about that a little bit, especially with the Division of Insurance?
Right. So what happens, too, is Division of Insurance is really good at helping consumers who are filing claims but not getting their money back, their benefits. And so, if people will just remember to let us know if it doesn't look right, if they're being denied a payment, we will go out and do investigations. And last year, do you help me with the number, Rebecca? What was the total number that we recovered?
More than $38 million back into consumers' pockets.
Isn't that great?
That's amazing.
Yeah.
Just with the Division of Insurance alone.
Oh, wow.
Yeah.
And let me just add on to that. Another really fun thing is that I got a call a couple years ago from a gentleman who said his mother had died, and she had Alzheimer's before she died, and had burned all of the paperwork in her house of anything that she just was not real sure what it was. And what she did was she burned all the life insurance policies that he knew she had. So he said, where do I start? I don't know what the companies were, but I know she had 2 or 3 policies. So we started working on a way to help people recover and find those policies. And so in working with our National Association of Insurance Commissioners, we now have a website whereby anyone who suspects that there's a policy, can go onto the website and find that policy. And all of the life insurance companies have to participate. Because in the past, and so that people can get the life insurance, in the past what would happen is we would have what they call a death master file. Doesn't that sound ominous?
Daunting.
Yeah, daunting. So we'd know everybody who died. They would then, find the money and then just divide it up If it was so much in Colorado, we'd get a check for 200,000, and it just goes into the general fund. Well, now that money's actually going to the families that it was supposed to go to.
Oh, that's lovely.
And that's another one. I think it's been about 10 million so far, hasn't it?
We put out a notice in August that it was 5.6 million
5.6.
back to consumers, but that was just for this past year. It didn't include the previous year.
So I'm so happy about that, because so many people don't realize that their loved one has paid that premium for so many years, and then to not have them be able to take advantage of it is just, it's not right. So, and the companies have it, so they need to pay it out.
Exactly. Yeah.
Yeah.
That's awesome,
Isn't
though.
that
I love
great?
that you're, and what a good story from that gentleman, right?
Right.
From something that was his mom
Seemed lost.
Yeah, exactly. Yeah. And I love that you guys were there to be the heroes in that situation.
Right. I know. Yeah, and I think that it's the story that we are government. Everybody, you know, sometimes people think government is this entity that's to the side that's really bad, but we're all just regular citizens trying to make sure that the rules, the protections that are out there to keep people safe and happy are followed. And that's what we do every day. And people, you know, it's just been such a pleasure for me to work with the staff who are so committed, because so many of them, for example, some of the engineers that work at DORA, we know that they could be out making so much more money, big salaries, but they're really committed to public service. And that's the kind of people that we attract to our department, are those, you know, I've got a woman who, she's got a PhD in railroad crossing safety. Can you imagine that?
I didn't even know that you could have that.
I know. That's where I was when I first met her. I said, "Are you kidding? You have a PhD in that?" But she goes all over the country talking to different groups about what to do and how to ensure that the crossings are safe, and what, you know, she knows everything about it. And we've got those kind of specialists. We've got those kind of people who, you know, people who have been big security, heads of securities and stuff like that, run their own departments, who now come in and are working for us because they've been on the other side and they know what could happen because they've been out in the private sector. And so, you know, now they come in to work with us and they can show us what's going on out there, and we can stop it from happening.
That's lovely. I love that so much.
Just in the next couple minutes, do you want to talk a little bit about the Vocal program?
Yes, this is such a wonderful program. You know, we have so many issues that revolve around veterans, and a Vocal is a acronym for
Veterans Occupational Licensing. No. Veterans Occupational Credentialing and Licensing Program.
Okay, so again, thank you for that. So the Vocal program is also being recognized around the country as a really great model, because what happens with so many soldiers is, you know, they've been off, they're all over, they're deployed different places, they are in different bases around the country, and so they're trained to do certain work, like say being a medic. But then when they come home, all of the work that they've done, all the training before didn't count toward a license. And so now we have been able to take all of that experience and apply it toward licensure so that they can use that in getting a license to do whatever it was they were doing in the service, and now get a job, not only for them but for spouses as well.
Oh, that's wonderful.
Yeah.
I love that you offer that to spouses too. That's such a cool concept, because you have these years of training and then they come back, and while they do have a GI Bill to go back to school, that's got to be monotonous because you're just relearning everything that you've already applied to real life skills.
Exactly. They've been trained. They've been actually doing it. So here's such a great program to do that. So you know, we're also doing a lot with licensing across state lines, and so we are part of a consortium of 11 states now that are looking to different occupations to make it a lot easier for people to move from state to state, to not have to start all over again, but to standardize credentials and licensing, so that if you're doing something in Kansas and you come to Colorado, we're not going to put a bunch of barriers in front of you to get your license, but we can use that information to give you a license a lot quicker here in Colorado.
Awesome. We're going to continue this conversation. We're going to take a quick break here on Connect and Collaborate, so stay with us. We'll be right back. Welcome back to Connect and Collaborate. Once again, I'm Alex Hopkins, your on-air producer, and we are having our monthly check-in with DORA, Colorado. Again, that's the Department of Regulatory Agencies of Colorado. And I have in studio with me Director of Communications for DORA, Colorado, Laurie, and also our guest here is Marguerite Salazar. She is the Executive Director of the Colorado Department of Regulatory Agencies. But interestingly enough, one of my favorite things about your bio here is that you were picked by President Barack Obama to help out with the Affordable Care Act, which is really neat.
Thank you.
Yes.
And I definitely want to talk about that a little bit later, but pressing, in my opinion, is really what's ahead. What's ahead for the department? And one of the things that we talk about a lot at the department is regulatory reform and the efforts behind it. Marguerite, can you highlight what the efforts that regarding regulatory reform have been when it comes to DORA's involvement?
Of course. You know, when I first came in, there was a lot of discussion again about the burden of regulation. And we always get complaints about there's so many regulations, and if government would just get out of the way, we could just do our job. And so we wanted to find out, well, what are those things that are burdening people? How much could we actually cut, but still preserve the safety and credibility of what the profession is? And so the governor asked us, and asked specifically DORA to lead the charge. Now, it wasn't only for the DORA department, but it was for every department in the state to take a really close look at all the regulations that we had and to see if some could be repealed or modified, or if we needed to just hold on to them. And so this effort was started by Barbara Kelly, who was the executive director in 2014, 14, and she called it Pits and Peeves. And I thought that was a real good name because it was, you know, what's really bothering you and what are those problems? So we went about, and of course there was initially a lot of low-hanging fruit. So people would see things that didn't make sense at all, started going through, and initially we were able to, we looked at over 24,000 rules. Can you imagine? I mean, there's more than that, but out of those 24,000, we modified 6,500 of them. And by modifying them, we made them, we updated them, we modernized it to make sure that they still basically made sense, but we knew that they were still really important. And we actually repealed 4,500. So, you know, I thought that was remarkable. The whole idea being that we reduce the burden on people who are trying to run a business, and instead of having 20 pages of rules to follow, maybe now they only have 5 that they have to do. And so that, I really believe that was a huge success. We haven't had as many because I still require everybody to look at that every year. We are still the chief under regulatory reform, and so we're still, you know, after all of the departments telling them to let us know how many rules have they reviewed, how many have they gotten rid of. But, you know, initially I think we did do away with all the low-hanging fruit, and so now it's fewer over time, but that's okay because we got rid of so many. And I know it's one of those things that the governor has been really happy about. So now we don't call it pits and peeves anymore, but we're calling it reducing the burden. And really that's our role, and that's what we're trying to continue to do. Every year we provide a very thorough report to the legislature about regulatory reform. And I'm really proud of that because I think when people start complaining about rules, I tell them, tell me which ones you don't like, and we will look at them, and maybe we'll get rid of them. So, and I have done that actually. There's some, you know, I'll tell you a story that was really touching to me, and it was when I was at the Division of Insurance, and I got a call, and it wasn't they screened this call because the person who called was really angry, and he wanted to talk to me, and he told the person on the phone that his mother had applied to get an insurance license a couple years ago and had been denied. And for some reason, the Division of Insurance had put that on our website. And so when she applied for another job at a restaurant, they had actually Googled her and seen that on the website, and they didn't give her the job. And he was really angry and hurt and saying, why are you doing that? Why would you do that? So when they brought it to me, I said, well, why do we do that? That doesn't make sense at all. And so we started researching it and looking into it, and there was no good reason. Somebody back in the day had started doing that, listing all of the licenses that had been turned down, and we didn't even know for what reason, but they were on the website. So we not only got rid of that, but we got rid of several other things that they were putting on the website that really had no reason to be there. So it helped the person who was doing it. It took that burden away from our worker, but then it really helped the people who were being impacted. So when we did that, I then got the phone number of that young man, and I called him. And he answered on the first ring, and I said, "This is Marguerite Salazar, the insurance commissioner." And he said, "Yeah." I said, "And you called me?" And he said, "Yeah." I said, "And I want to thank you because your voice was so strong, and this is what you did, and this is what I've now done because of you. So thank you for doing that. Thank you for taking the time." And he was floored. He said, I don't know what to say, and I was really mad. And I said, "You did the absolute right thing.
Yeah.
Thank you for standing up for your mother, for letting us know that what we were doing was not right. I took care of it." And so, it's those kind of things and he was really happy. And I'm thinking, instead of him now going out and saying all the terrible things we've done, maybe he'll say, "Hey, they fixed it, you should call." And I think that's the message of, just call us and we will try to figure out if something doesn't make sense, we'll deal with that.
That's awesome. I think one of my favorite things and an overarching theme that I've seen every time we have a show is how accessible DORA is. And I think that's one of the things that we as civilians don't really know, how accessible our government really is.
And we do work hard to help Coloradans understand how they can access DORA in the different ways. The last time, for example, we were talking about cost-benefit analysis, those requests that would come in, that if a rule is going to be proposed, anyone can challenge it and say, well, prove to me that we really do need this rule. What's the cost benefit of having this particular rule?
Right.
And there's a lot of ability for citizens, Coloradans, to participate in the government process. And so trying to help them understand those different ways is part of our job. And it's one of the reasons we come on this show. It's so many of the reasons we're out in the community and talking and sharing these different kinds of stories, because it can sometimes be just one phone call, as Marguerite says, to really institute some big changes, because government can be big. Mm-hmm. And sometimes there are things there that, we don't realize need to be changed.
Exactly.
It is up to the people to help us understand how we can be better.
Right.
In so many respects.
Right.
Yeah.
One of those ways is just simply improving our technology.
Exactly,
right?
Exactly, right.
Do you want to highlight what we're doing right now with that?
Because this is another one of those things, I think, in reducing the burden, in that we have gone completely electronic in having people receive their licenses. So we have a system, it's called e-licensing. So instead of filling out 50 forms, turning them in, duplicates and that kind of thing, people can actually just go online and get their license. Apply for the license and then get it. So we've been working on that, and we improve it, every year. In fact, right now we're going through a process because we're going to go into our second generation of e-licensing to make it even smoother. And we issue close to 1 million licenses a year between.
Wow.
Yeah, isn't that amazing?
Yeah.
And it's I think it's like 900,000 individuals, and then all the businesses on top of that another 50,000 or so businesses who get licensed through us. So there's no way we could do it physically and then we have all the real estate agents licensing, all the insurance licensing, the securities, all of those things. So we are always working to improve that process. Plus the case filings for civil rights is actually now done electronically as well. What's the consequence of that, though, is that the number of cases coming in has really gone up because it's a lot easier to file. And sometimes there are cases that people, if they just sat down and talked, they could sort it out. And so we're doing a lot of that kind of thing too, just having mediation done so that people get, oh, is that what you meant? Oh, I thought you meant this. And then, so we're dealing with those in that way too. But at least people feel like they have a way to complain and get some of those issues taken care of. We're always working on our website as well. And on the website, we've got different videos that we use to educate people. We've done a lot this past year in insurance and other topics too. What was some of the other ones, Rebecca, that we did in terms of videos?
Yeah, the Division of Insurance rolled out an entire series of videos of how to understand your health insurance or working within the insurance environment and navigating insurance. And then Division of Real Estate put out video advisories for the real estate industry on best practices. In fact, the Division of Professions and Occupations do a lot of work in terms of webinars and incorporating videos for training their licensees, as well as doing stakeholder outreach. And so, of course, technology is just one of those essential components that we are incorporating more and more as people adopt it and become more familiar with it.
Yeah. Well, and one of my favorite things I think about your website is how user-friendly it is. Because I go in there, I tag DORA Colorado every time we do a radio blog post, and I get in there and I'm just typing things in. I'm like, we just talked about this, or this person's coming on. And it doesn't matter what I type in there, there's something that they can find. And it doesn't matter if I've spelled it wrong, if it's an acronym and I don't know it right or anything. Super user-friendly. And so I think that's great that you constantly update your website, because not a lot of government entities do.
Right.
Thank you.
Well, we've also got a chat feature through the Division of Insurance, and I think we're the only department that has that right now. So when people get on, they can start, there will be a staff person who can say, can I help you? What are you really looking for? So that is really a cool feature as well.
Yeah, it's actually department-wide.
Oh, it is now?
Yeah,
okay.
It is. The chat feature is department-wide, and just like if you were to chat with any other company to try and noodle something out, it is there for anybody to be able to submit their question and then get directed to the right place. It's all this effort to make sure that we have the best customer service that we possibly can have to be able to help consumers, as well as the regulated individuals, which, as Marguerite mentioned, is around 900,000 people. 1 in 7 workers in Colorado are licensed with some sort of professional license. And so we have an entire welcome center there for them to walk in if they want. There are kiosks for them to use. There's a chat online chat. We have our website. We are doing whatever we can, and we're always looking to improve it. Yeah. Absolutely.
Now, is that chat feature 24/7 available?
We've actually talked about expanding those hours and what might that look like, but for now, it's really just your regular business hours. The hours are posted on the website.
Which is fair. Right. I don't blame you at all on that. I think that's great. And I love that you said customer service, because that is definitely not something that I associate with a government entity at all, right? I think, legalese, perfect. The Division of Insurance, and yes, I know that I can find help, but customer service isn't an element that I thought of at all. So, yeah.
It's a very crucial element.
Yes.
Absolutely.
Mm-hmm. Yeah. It's just not one I associated. So. I learn something new every time.
That's
good. Good.
Marguerite, I did want to touch on your experience with ACA. And, that has just been such a trajectory. And you have been right there following every twist and turn that there's been through the 2 administrations. Where are we at now with health insurance and the health insurance landscape? And can you give the perspective of where things are going?
Sure. Well, I'll start with the good news in that we're continuing to be really strong here in Colorado. The rates that we're currently working with today, because open enrollment started November 1st and it'll go through January 15th. So people are still actively buying insurance, and what they're finding is that if, again, not everywhere, because I know that the rates are still pretty high in some of the resort areas for middle-aged to older people, but in general, they have really gone down, sometimes 35%. There are some plans that people can buy for, $20 a month. So it's really looking good. So what we've lost, though, is one of the real important pieces of the ACA, which is the individual mandate. And there is a fear that people will drop their insurance, that they, and with the insurance market, the bigger the pool, the lower the rates are going to be. And so if we start losing people who just feel like I don't really need it, and the government was forcing me to have it, and I didn't like that, and they don't buy it, then, that's a problem. But, in general, when I go back to, you mentioned my days working in a community health center, most of my work was around trying to find resources to pay for the care for people who didn't have insurance. And it really was that middle ground, because the poorest of the poor have Medicaid. And then you've got people who are working who, have a viable job, and their employer provides health insurance. But so many times there were the part-time workers, the people who worked at, just 30 hours a week and couldn't afford to buy health insurance. And so they were the working poor. That's the group who has really benefited from the ACA. Those are the people that we see now are able to be covered, and they can't be denied because of a pre-existing condition. And I think that is one of the most important tenets, and I think we saw that in this last midterm election, how everybody, no matter what side you were on, agreed that people should not be denied care because of a pre-existing condition. So we really have come a long way in that regard. And if you talk to anybody across the country, healthcare and the provision and the ability to buy insurance is the number one issue for people, because we used to see so many bankruptcies. Personal bankruptcies because of a health issue was the number one reason why people were filing. So, that's just devastating. Colorado, we are doing well. The cost of care in Colorado, though, remains high. And we've all seen the reports. There was one a couple of weeks ago that showed that our hospital costs are about 31% higher than the average across the country. Outpatient provider care is about 10 to 13% higher. So we really have to work on getting those costs down, and so that the insurance rates will then also continue to go down. We do have lots of providers, of health insurance, and that's something that I worked really hard with the staff to keep in Colorado, because I would see our neighboring states like Wyoming who only had one insurance carrier. New Mexico for a while only had 3. And so we are really, it's like an embarrassment of riches. We have 9 providers, and we have a statewide provider, which is Anthem Blue Cross, and a lot of states don't have that. So, the Division of Insurance works hard to nurture those relationships, to make sure, again, that we're not making it really hard on those companies. We hold them to their contracts, though. We make them do what they promise their clients or their members they have to deliver. But at the same time, we are trying to have and create a market that really does encourage creativity and helps them try to keep people healthy. So we're seeing a lot of that. And look at the statistics. Colorado remains one of the healthiest states in the country. And so a lot of that has to do with that we have a 6.4 uninsured rate. When I went to work for the Health and Human Services, we were at 17% uninsured here in Colorado.
Wow.
Yeah, so it's huge, and the good thing about that is it's not a fluke. It has stayed low. It dropped to like 9, and then it dropped to 7, it dropped to 6, and it stayed there. So we know that it's probably for now, a permanent place, and so we just have to get to that last 6% and figure out who they are and why they don't have insurance. But it's something to be very proud of.
But time certainly should tell. If the overall population really is, getting the care that they need, and that the real serious problems start to decline because they're being caught earlier.
Right. And an indicator of that has to do with the idea of, that the Division of Insurance every year calculates what they call a loss cost ratio, and that ratio is what determines the rates that workers' compensation can charge. So every year since the ACA has been implemented, that ratio has gone down. And so the cost of workers' comp insurance has gone down as well. So what I believe is that in the past, because people didn't have insurance, they were all going to workers' comp to get care and blaming their work for their illness. Today, because people can get care, they can go to the doctor, they're not going to workers' comp. Therefore, the rates are going down for everybody.
Certainly a lot to be proud of.
Yeah.
Absolutely. In our last few minutes, Marguerite, thought you could discuss what's ahead, specifically regarding DORA's strategic initiatives. All the departments have a strategic plan that they submit to the legislature, and we have 3 key strategic initiatives as part of our performance plan. Marguerite, do you want to highlight those 3 initiatives?
Sure. The first is improving public protection through effective enforcement and regulatory activities. So, that really goes right to what I've been talking about this whole time, that we're not just going after people to go after them, but making sure that it's honest enforcement, that, we're helping. We don't shut people down automatically. We actually do a lot of prevention. We work with them. We help them understand what they might be doing wrong. For example, we get a lot of information about hairdressers and barbers whose licenses have expired. Well, they're not trying to do something criminal. Many times they just forget. They don't realize that it's expired. So we don't need to go in and shut the door and give them a cease and desist, but we'll work with them to make sure that they understand how important it is that they keep those licenses up to date. And we're working on ways to get to them early, to give them maybe a 3-month, not a warning, but a notice, your license is going to expire. Maybe you need to do something about that. The second one is enhancing education and outreach. And that is so key because, again, that goes to the prevention. We spend a lot of time out, having tables at different activities or different, things that are going on. When there's, say, health fairs or things like that, our Division of Insurance will go out there to help people understand what it is they should do to enroll in insurance, and if something's wrong with that insurance plan, how to come to us. We do radio shows like this. We do videos. Rebecca is out all the time working with different groups to help people understand the different pieces of every one of our divisions. And we do a lot on social media as well, because we know that that's where so many people get their information. So we're trying to make better use of that. We're learning more and more about how to properly use social media. And then the last one is to improve the processes to better engage with the regulated entities. And I think, again, we don't want to be their enemy. We don't want to be the people that they hide from, but we really want them to see us as partners. We really are there to help them out. One of the things I've really been supporting is the idea of, say, like our electrical inspectors doing regular seminars out in the community to work with all the electricians so that they know what we're going to go look for when we do inspections. Let's give them the answers to the test, basically. Let's make sure that they know who their inspector is, or the plumbing inspector, so that they can be friends with them in a sense and know that we're there to help them. We're here for consumer protection, but there's a lot of ways we can do that.
Awesome. Well, I think 2019 is going to be an even bigger and better year for DORA. And I'm excited for you guys. And as always, we'll continue our series into 2019. But it has been great having you both in here, and have a wonderful holiday season. I will see you in January again.
Yes, the new year. Thank you so much, Alex.
Yes.
And thank you, Marguerite.
Thank you, too.
Yes.
Happy holidays.
Yes.
Happy holidays. Be sure to like and subscribe our YouTube page while you're here. Check out this podcast and more at cobrt.com/radio-podcast. Type in DORA Colorado for all of our videos.